Hello and welcome. Today we're delving into the world of eye health to explore a condition known as chemical conjunctivitis. This isn't your typical pink eye. It's an inflammation of the conjunctiva, that delicate membraning your eyelid and covering the white part of your eye, caused by exposure to irritating chemical substances. Join us as we uncover the causes, symptoms, and management of this sometimes painful condition. So, what exactly causes chemical conjunctivitis? The primary culprit is direct contact of the eye with various chemical irritants. Common offenders include cleaning agents like bleach or detergents, industrial chemicals such as acids or alkalis, aerosols, including hairspray and some perfumes, and even improperly chlorinated swimming pool water. The severity of the conjunctivitis often depends on the type, concentration, and duration of exposure to the chemical. Even seemingly harmless substances can cause irritation if they come into contact with the eye in sufficient quantities or concentrations. Now, let's understand how chemical conjunctivitis develops. When a chemical irritant comes into contact with the conjunctiva, it triggers an inflammatory response. This response involves the release of inflammatory mediators, such as histamine and prostaglandins, which cause vasodilations, a widening of blood vessels, and increased permeability of the capillaries in the conjunctiva. This leads to redness, swelling, and increased tear production. In severe cases, the chemical can damage the surface cells of the cornea, the clear front part of the eye, leading to pain, blurred vision, and even scarring. Understanding who is at risk is important. Chemical conjunctivitis doesn't discriminate, but certain groups are at higher risk. Individuals working in industries where chemical exposure is common, such as cleaning, manufacturing, or agriculture, are particularly vulnerable. Improper use of household cleaning products can also lead to accidental exposure. Swimmers may also experience chemical conjunctivitis from improperly chlorinated pool water. Essentially, anyone who handles or is exposed to potentially irritating chemicals without proper eye protection is at risk. How can you tell if you have chemical conjunctivitis? The signs and symptoms can vary depending on the severity of the exposure. Common symptoms include a redness of the eye, a burning or stinging sensation, excessive tearing, a feeling of gritness, or that something is in the eye, blurred vision, and sensitivity to light, also known as photophobia. In severe cases, there may be significant swelling of the eyelids and conjunctiva, as well as pain. Diagnosing chemical conjunctivitis typically involves a thorough examination by an eye care professional. The doctor will ask about your medical history, including any recent exposure to chemicals. A visual acuity test will assess your vision. The doctor will examine your eyes, including the conjunctiva and cornea, using a slit lamp, a special microscope with a bright light, to look for signs of inflammation or damage. Sometimes the doctor might use fluorescein staining, where a special dye is placed in the eye to highlight any corneal abrasions or ulcers. While chemical conjunctivitis is broadly defined by its cause, it can be classified by severity. Mild cases may present with only redness and mild irritation. Moderate cases can involve more significant tearing and discomfort. Severe cases may involve corneal damage and significant pain. The treatment approach varies depending on the severity of the condition. The primary goal of treatment is to remove the offending chemical and relieve symptoms. Immediate and copious irrigation of the eye with clean water or saline solution is crucial. This should be done for at least 15 to 20 minutes. Medical management includes lubricating eye drops or artificial tears to soothe the eye and reduce irritation, topical antibiotics if there is a risk of secondary bacterial infection, and in severe cases, topical corticosteroids to reduce inflammation. Pain relievers may also be prescribed to manage discomfort. A follow-up appointment with an eye doctor is important to monitor healing and prevent complications. Prevention is key to avoiding chemical conjunctivitis. Always wear appropriate eye protection such as safety goggles or face shields when working with chemicals. Read and follow the instructions on all chemical products carefully. Store chemicals properly, out of reach of children and pets. If you accidentally get a chemical in your eye, immediately flush it with water for at least 15 to 20 minutes and seek medical attention. The prognosis for chemical conjunctivitis is generally good, especially with prompt and appropriate treatment. Most cases resolve within a few days to weeks without any long-term complications. However, severe chemical injuries can lead to corneal scarring, vision loss, or even glaucoma. Ongoing research is exploring new ways to protect the eye from chemical damage and improve treatment outcomes. This includes the development of more effective irrigation solutions and anti-inflammatory medications. Thank you for joining us in exploring chemical conjunctivitis. Remember, protecting your eyes is vital, so always take precautions when handling chemicals.